Hey everyone, this is Jashanpreet. Here I would like to share my views on our topic that is nutritional intervention of sodium intake on preeclampsia and pregnancy. So first of all, what is preeclampsia? It is a health disorder that is detected during pregnancy. It is mainly characterized by high blood pressure and protein in urine. It leads to maternal and prenatal mortality if not well managed. It affects 2 to 8% of pregnancies. It also affects a woman's liver and kidney if not well diagnosed. There are some other symptoms that are related to preeclampsia like change in vision, upper abdominal pain, nausea or vomiting, or decreased urine output. So now is the role of sodium in blood pressure regulation in pregnancy. One of the main role of sodium is regulation of blood pressure during pregnancy. Here I would like to discuss a case study that is related to a woman that is 45 years old and her name is Gravida. She is a 45-year-old pregnant lady with twin gestation who is conceived in vitro fertilization with the donor egg. The principle of this case study at the initial stage was to manage the preeclampsia till the due date of delivery, but it wants to so which leads to emergency delivery at only 33 weeks of gestation. After 30 weeks and 6 days, she diagnosed with the preeclampsia during her test report. After 31 weeks, she admitted to hospital due to constant headache and blind spots, which resolved after a while. All parameters are still stable, but sodium serum declined. Then, after some days, her case start worsened, and which leads to emergency delivery due to only preeclampsia. One of the research suggests that low sodium intake might be a risk factor for preeclampsia development in pregnancy. So sodium potassium ATPase activity is developed studies show that EDLF endogenous digoxin-like factor in bloodstream inhibits the active function of the sodium pump, which functions in regulation of sodium potassium ATPase activity and inhibit this enzyme and which might cause preeclampsia symptoms. So it is mandatory to treating high or low blood pressure in pregnancy, like for high blood pressure, taking medication, eat healthy, like balanced food with proper nutrients like carbs, protein, vitamins, water, minerals, and manage stress, like do some activities, exercise, light exercise or yoga. Avoid alcohol and smoking. For low blood pressure, stay hydrated 3 to 4 liters water in a day, consume enough calories, avoid standing for long periods, and move from horizontal to a standing position slowly. So next is the pathway of the preeclampsia. So it's accurate pathway by which sodium intake contribute to the development of preeclampsia is not yet understood clearly. But it shows that placenta of the fetus to be the most important component in pregnancy that leads to this disorder. When the blood vessels that are supplying blood to the placenta do not properly develop, it leads to the limitation and reduction of blood flows to fetus. It causes stress on the placenta activity. This leads to the restriction on the growth of the fetus and stillbirth. So, maternal risk factors are also included in this, like including obesity, chronic high blood pressure, organ diseases in first pregnancy, previous pregnancy complications, like some has family history, age factors like lower than 20 years or being higher than 40 years. It also have some effects in vitro fertilization, and the majority of African and Hispanic people are also, I mean, that has effect from preeclampsia during their pregnancy. So, thank you.
Hi everyone, this is Aderonke Florence Oloyede. I'm just going to continue where just stopped. I'm going to be explaining and talking about clinical intervention, reduction of sodium in pregnancy. Due to the resulting service issue and cases connecting to the intake of sodium and pre-eclampsias, medical and dietary intervention that aim towards the reduction of sodium intake during pregnancy have been researched. Medical approach. Aspirin has been found to be effective in reducing the rate of pre-eclampsia development when administered at the right dose and timing. Dietary lifestyle approach. Modifying diet intake and physical exercise can help improve the risk of pre-eclampsias. Why dietary supplements and hydration are also recommended. The next slide shows preeclampsias and its links with cardiovascular disease development in later life. And on the other side, shows prebiotics and probiotics. Prebiotics is food for bacteria. Probiotics are substances that can only be metabolized by gut bacteria and not the human host. And probiotics are live bacteria. Probiotics are active bacteria's culture. This middle one is symbiotics. Symbiotics are combination of both probiotics and prebiotics. I am going to be explaining how to use aspirin in preventing pre-eclampsias. According to Ronick 2022, which talk about the positive impact of aspirin on pre-eclampsias in pregnancy. Aspirin is considered one of the oldest existing drugs that is still commonly used worldwide. It was agreed that aspirin, which is found in the family of non-steroidal anti-inflammatory drugs, has an inflammatory and analgesic effect. Therefore, it is believed to inhibit inflammation and aggregation of platelet, which leads to low level of placenta infraction, hence useful in the treatment and prevention of pre-eclampsia development during pregnancy. A series of continuous analysis of total data collection shows that aspirin is very effective in the reduction of the rate of the development of pre-eclampsias if its treatment started before the gestation age of 16 weeks, but shows no beneficial effect if started after 16 weeks. It was discovered that administer a daily dose of aspirin 150 grams as early as 16 weeks, which is the period when placentation is complete, helps in placentation improvement at the birth time, and at the birth time helps to regulate blood pressure when at rest. As a result of this, in a reduction of pre-eclampsias. As results in reduction in pre-eclampsia rates by 62% than when administered after the onset of the pre-eclampsia complications. The use of aspirin is completely considered safe in pregnancy and has been proved not to have any increased risk of the fetus development congenital or any other abnormal development through its usage. However, it is yet to be determined if aspirin use in the prevention of Preeclampsias will result in a lower rate of cardiovascular disease occurring in later life. If the cause of preeclampsia is as a result of placentation impairment, which often leads to damage to the cardiovascular system, it is being possible and likely that the use of aspirin in pregnancy will help in decreasing the rates of cardiovascular disease outcome in the future. The pregnancy plate and the diagram on this slide explain the dietary lifestyle and how to prevent preeclampsia during pregnancy. It is recommended to increase the intake of fiber in the diet as it will help in maintaining weight and reducing cardiovascular disease risk. In comparison, pregnant women with preeclampsia are found to have high triglyceride and low density lipoprotein cholesterol in their blood, which are ultimately known to cause hypertension and cardiovascular disease in their body. From the case study, according to Perry, 172 women with symptoms of preeclampsia, it was discovered that with the highest intake level of fiber in their diets had a 5% decreased risk of developing preeclampsia than women who were low in fiber intake in their diets. Therefore, it is recommended that a daily intake of dietary fiber in pregnancy of about 25 to 30 grams per day, but not above this recommendation, will greatly reduce the preeclampsia risk. Fruits and vegetables. Research proved that incorporating high daily intake of fruits and vegetables, both fresh and dry fruit, have all contributed to a reduced risk of pre-eclampsia complication. Also, nuts, legumes, fish, and whole grain taken at least 3 times a week have positively affected pre-eclampsia risk. Facts prove that fish and other kinds of seafood contain peptides with antioxidants, antihypertensive, and anti-inflammatory, which help in improving the risk of developing preeclampsia. I'm going to stop here and Sam will continue. Thank you.
This is Masuma Goldis and I'm going to presentation slide 9 and 10. Supplements. Research carried out on dietary intake of calcium and other supplements and its relation to preeclampsia development found that moderate and appropriate intake of dietary electrolytes after 20 weeks of gestation till delivery can help stop preeclampsia in pregnancy. From the case study carried out on 3 different sets of pregnant women, it was discovered that low simple intake of calcium was actively related to the prevalence of preeclampsia development. After adding calcium intake to the diet of this preeclampsia woman, there were slightly improved observations based on the research, while potassium, magnesium, and calcium were traced to help improve the risk of developing preeclampsia. Sodium, with its significant factor for chronic hypertension, its connection with negative onset of preeclampsia remain unclear. Therefore, it's recommended that pregnant women be screened at the earlier stage of gestation for preeclampsia risks, and those with possible risk of development at the later stage of the pregnancy be intensively followed up throughout their pregnancy. They receive nutritional health counseling. Other supplements such as vitamin D, selenium, folic acid, vitamin B12, iron, and multivitamin or minerals are important and necessary dietary supplements that are necessary not only in the pregnancy, but also highly recommended for women who intend for pregnancy and become pregnant soon, because it helps in the proper formation of babies, particularly in the reduction, prevention, and management of the risk of developing preeclampsia. As a conclusion, the impact of sodium intake on preeclampsia in pregnancy has been reviewed this research work. It was studied that the low sodium level that occurred during the pregnancy was treated and managed. However, it got worse over time, and emergency delivery of the woman and her baby was the only solution. Therefore, this case study proved that hyperthermia cannot be treated except a swift delivery as the only solution to resolve preeclampsia risk. And the link between sodium and preeclampsia showed that the EDELF in the bloodstream inhibits the sodium pump, which functions in the regulation of sodium-potassium ATPase activity in the body system. Also, the treatment of preeclampsia, maintaining a healthy weight, and consumption of natural probiotics, fruit, vegetables, and other healthy diets help in the dietary lifestyle intervention of management of preeclampsia. Also, aspirin, with its anti-inflammatory and analgesic effect, has been useful in the treatment and management of preeclampsia in pregnancy. Based on the research on the impact of sodium intake before, during, and after pregnancy, women with chronic hypertension symptoms are advised to maintain a low intake of sodium in their diet. This is done by reducing the rate of consumption of sodium or implementing substitution of dietary sodium in their daily meals to reduce the level of their blood pressure. It's also ideal and beneficial for normal blood pressure women who are interested in becoming pregnant later to maintain a low sodium intake lifestyle to reduce the risk of developing preeclampsia in their next pregnancy.